and welcome to the Queen Elizabeth Patient Podcast. I'm here today with Dr. Peter Blackburn, who is an NHS consultant in clinical psychology and works in oncology and palliative care. He's interested in acceptance, compassion, values, guided living. And today he's talking about worry. So Peter, thank you for coming today.
Thank you for inviting me. Today I'd like to talk about worry, understanding what it is, and then looking at ways to maybe worry more effectively. This podcast will discuss how it's normal to worry about cancer returning after treatment. We'll also consider ways to cope with worry so that it is less bothersome and enables a more fulfilling life by living in the present moment. The ways to cope can be used for worry about cancer returning or progressing, but also if you fear other things happening in your life.
Before we start thinking about fears of recurrence, Peter, can you just explain, what exactly is worry?
Yeah, that's a good question. Worry is a normal behaviour. We all worry from time to time. Worry is what we call a strategic behaviour that aims to deal with uncertainty. It's a method for solving problems and planning ahead. Worry is a chain of mostly thoughts and sometimes images, resulting in negative predictions or doubts. A worry can start small and become big. It can start with one concern and move on to other concerns. We rarely share our worries, and worry leads to an imagined future and a loss of present moment living. Worry can be productive. It can be useful if it makes us pay attention. It is useful if it can be turned into a solution that leads to a plan of action. And worry is useful if it helps you be better prepared, but only if it leads to action. For example, what would happen if my house was burgled needs to lead to action of ensuring you have a good security system and home insurance. Helpful worry also needs to be manageable, which means you can control it. It doesn't disrupt activities of daily living, it doesn't cause significant distress, and it's limited to a specific small number of realistic concerns. Worry is problematic when it's unproductive, i.e. it does not lead to solutions, plans or actions, and worry is problematic when it is unmanageable because it's excessive, intrusive, persistent, uncontrollable, repetitive and very distressing.
So Peter, can you explain exactly why do we worry then?
Worry has developed as a consequence of evolution, helping us to be cautious and to solve problems.
But some people, worry causes them more problems than others. Can you explain a bit more about that?
Researchers believe that levels of worry are influenced by our genes, but mostly our childhood experiences, adverse life events, and our current stress levels and mental health.
But obviously, this amount of worry, there surely's got to be consequences of unproductive worry.
Yeah, excessive, intrusive, and uncontrollable worry would lead to muscle tension, restlessness, fatigue, irritability, sleep disturbance, demoralization and difficulties with memory and concentration.
So what exactly maintains problematic worry?
People continue with unproductive worry because they often hold one or more of the following beliefs. Worry helps me solve problems, but only if it leads to action. Research suggests that unproductive worry by definition does not solve problems, rather it generates more uncertainty and therefore more worry. Another belief is that my worry motivates me, but only if it leads to action. Otherwise, it will be demoralizing because no solutions are acted upon. Another belief is, if I worry about these things, then they won't happen. And that's similar to a superstitious process. But some people will mentally record how worry is in this way has supposedly stopped a catastrophe, and so continue to hold the belief. And the final positive belief about worry is that worry helps me prepare for the worst. And this can be helpful if people develop contingency plans and then just park them and get back to everyday life. However, it is problematic when people continue to repeatedly worry about the worst, but there is no change in their contingency plans.
Being a cancer specialist nurse, I often get questions about, and worry about cancer returning, and, how many people really experience this sort of fear?
Research varies a little bit, but the figure that comes up most is approximately 50% of people who have been treated for cancer worry that the disease will return. 1 year after disease, people's overall distress decreases, and for some reduces further after they have successfully completed treatment. However, 33% of people will continue to have this fear 10 years later. Fear of recurrence is an understandable response to a real threat. For many people, a diagnosis of cancer is very distressing because it is one of the biggest fears we have, and it is often unexpected. Fear of recurrence can begin at diagnosis or later on. Many people start to worry after treatment has been completed. They describe how during treatment they have been too unwell to worry, or being in treatment has reduced their fears. For some people, their worries about cancer returning sits at the back of their minds and then are triggered by specific events such as an up-and-coming medical appointment, especially related to cancer, an anniversary of the cancer diagnosis or treatment, hearing about another person's being diagnosed or treated, or even sadly dying from cancer. Any mention of cancer, such as on TV, or hearing about a famous person having it, the side effects from previous cancer treatment, new or unexplained symptoms. There's a variety of triggers that can activate this fear. For other people, their worry is at the front of their minds, constant, uncontrollable, intense, and very distressing.
So Peter, what makes some people more sort of susceptible to fear of recurrence, and what leads to others worrying about it all of the time?
Being diagnosed with cancer is often described as unexpected, with the belief that the disease can be life-threatening and therefore very distressing. This experience can be traumatizing and can be similar to those who have been in accidents or have been attacked. Unexpected, frightening, potentially life-threatening, not chosen and out of their control. Therefore, how well someone has or has not made sense or processed the trauma of diagnosis or treatment may then influence how much they worry about recurrence. Also, current mental health problems, pessimism, current stresses such as financial problems or relationship disharmony can influence fear of recurrence. For those who worry constantly, it might be the trauma of diagnosis or that they have worried for much of their lives. Worry can disrupt people's lives by causing distress, tension, depression, anxiety, stops them having fun, being with friends and family, stops things getting done, planning for the future, and attending or arranging medical appointments. People report many ways to cope with their worry. Some are helpful, including sharing their worries with friends, relaxation, yoga, meditation, problem solving. Less helpful ways to cope are various forms of avoidance, such as staying constantly busy. Being constantly busy blocks fears and is hugely exhausting. And this leads to people being too occupied or too tired to think about their worries. But by being constantly busy, they do not have time or energy for the enjoyable things in life.
So Peter, as a psychologist, what would say the most helpful ways to cope with this is?
The following ways to cope are evidence-based strategies used in cognitive behavioural therapy, acceptance and commitment therapy, and compassion-focused therapy. Many of these strategies need courage and determination. Therefore, you need to consider what concerns you about unproductive, excessive, intrusive worry. What will you gain from letting go of this kind of worry, and what will be gained from using these alternative ways of coping? Also, you will need to keep reminding yourself why you have chosen to use them.
And can we sort of prepare for periods of excessive worry?
Know your triggers and have a number of ways to cope with them. This reduces the chances of being caught unaware. Being prepared may give people a sense of choice and control in how they cope. Therefore, choose a time when you are not worried or anxious or low in mood and think about what might trigger your worries. Against each trigger, write a way to cope. So, for example, a sensation or symptom that concerns you, you could use the problem-solving technique that we'll talk about soon, and then seek advice from your clinical nurse specialist. For an up-and-coming medical appointment, allow your worries to increase in the week before and allow them to be present until you have the results of any tests. For an anniversary that reminds you of cancer, then pause. Find gratitude for yourself for the journey you have been through. Research has shown that gratitude improves our mood. When cancer is mentioned, say on TV, express your feelings to someone you trust. Find supportive others or write them down in a journal. If you share with a friend, explain to them that you do not need solutions from them. Only someone who can listen to your worries. Discuss your risk of recurrence or progression with your clinical team. Understand what the statistics mean for you. Explain to them what you understand so that they can confirm that your understanding is accurate. Take a list of questions during appointments. Also make notes about what you're told about your disease and treatment. Learn about possible signs of recurrence to understand which symptoms are important. Focus on the facts and do not try to add extra information from the internet. So, my turn to ask a question. What do you think people should look for if they're worried about recurrence?
Obviously, I work as a breast cancer specialist, so that's kind of my area of expertise. But if a woman rang me to say that she was worried about, often we'll tell them about self-examination and looking for something that's new. The difficulty is obviously the body has changed. It's gone through a process of chemotherapy, radiotherapy and surgery. So, from the breast point of view, it is constantly changing following these treatments. But, be vigilant. But at the same time, there's also a part of you that's got to sort of think, a new back pain, prior to being diagnosed with cancer, we all at some point we will experience a little bit of a niggle in the shoulder or, some back pain. And often it's mechanical, have we been gardening, have we been doing some new sport or, been painting excessively, and I think, again, probably a lot of the pointers that you've gone through, Peter, about sort of rechecking, and trying to flip it, not automatically being the first thing as you think of as cancer, and maybe treat it with analgesics maybe for a week or so. But if it's a pain that is getting worse and worse, or it's a lump there that still persists, please don't sit at home and just stew about it. What I would do is, if you've got your key worker, your specialist nurse, and this is any tumour site, if there's something there, after a couple of weeks, it isn't any better and it's playing on your mind, it is so easy just to pick up the phone and just sort of cross-reference with the specialist and just say, is this worth worrying about? And often or not, we can reassure you or bring you in and do a quick check.
That's really helpful. I think we've probably generalised that advice to other cancers, thinking about how to monitor for potential symptoms, not coming to the first conclusion that it's a recurrence of cancer and just ruling out the more everyday reasons why this sensation or symptom might be occurring. I think it's worth keeping copies of any letters that you've got that are regarding your cancer diagnosis, anything to do with treatment, keeping a record of these so that you're working with the information you've been given. You can also think about how successfully you've coped with stress and worry in the past and draw on any lessons that you've learnt, any skills that you've learnt to cope. Trust yourself is probably one of the big things that actually recent studies have shown that 85% of the things that we worry about end up having a positive or neutral outcome. Even when the outcome was negative, 79% of the time people believe that they handle it better than they would have predicted if they'd worried about it. When people realise that they are more able to cope, then they may choose to worry less and spend the time gained living in the present, getting the most out of life.
So I suppose positive action rather than positive thinking and focus on what you can do and control is probably the most important message that you're trying to get across.
Precisely. Rather than worrying about if the cancer will return, focus on behaviour that may reduce the chances of recurrence. These include stopping smoking, reducing alcohol intake to a few units a week, eating a healthy diet such as the Mediterranean one, exercise daily, and that doesn't mean being in a gym, it doesn't mean running for miles, just getting the heart beating a little quicker. Meditation, yoga, manage everyday stress, use problem-solving techniques, challenge inaccurate thoughts and identify more helpful ones. Social support is one of the biggest ways to cope with life, but it's also one of the best for challenging periods of life.
So Peter, can you tell us a little bit more about the problem-solving technique?
Yeah, this is really helpful for worries that are actually happening. And it's advised that you get a piece of paper and you write down what you're worrying about very specifically, and then coming up with a number of possible solutions. And when you've got the solutions, look at each one and come up with the sort of pros and cons of each one. And hopefully by the end of looking at all your solutions, one will stand out. Pick that one and then decide when is it going to happen. So create a plan and then do it. And I think it's worth reflecting on the outcome. How well did your action go? So that you can learn to use it again or modify it. So let's go back to that example about concerns about how secure my home is. I'm worried about that. Is it safe enough? Have I got the best safety? And the possible solutions could be to call the police, ask them to do a security check, call the local alarm company and ask them to do a check, maybe ask a locksmith to do a check. Go on the internet, I'm sure there'll be a checklist of making your home secure. Weigh up all the pros and cons to this. I'm sure that the police would like to do these things, but they may be a bit busy. A locksmith or an alarm company, I'm sure they'd be keen to come and advise. Equally, the internet may provide some answers. And let's say that my burglar alarm is old and creaky, if that's such a word for an alarm, and therefore I decide I'm going to call the burglar alarm company. Well, when's that going to happen? Let's get that in the diary, on the calendar. There's nothing more I can do until I make that phone call and get them to come out. And they can do their work and I can reflect if that was a helpful thing. Does that make sense?
Yep.
Another strategy for coping with worries that are actually happening is something called postponing worry and worry time. And the aim of this is to reduce the amount of time that people are worrying. The more time people give to worry, the more it will just fill their lives. And this approach is about compartmentalizing worry. And it's deciding on a time of the day when you're going to worry and to sit down and worry for 10 minutes. And you're allowed to worry about anything and everything. And once that 10 minutes is up, then it's time to move on to doing something else in life. If you start worrying at any other time, then you need to postpone that worry and acknowledge it and go, oh, I notice I'm worrying, but it's not worry time. I'm going to postpone it till tomorrow. It's worry time. And this is a behaviour that needs a lot of practice. It's quite challenging. The mind is desperate to try and solve a worry, but if it can't be solved right now, then it's about being able to park it and worry about it for a short time each day.
Well, thank you, Peter. I think you've given us a great intro into coping with worry, and breaking it down. It is so important as well to understand why we worry and why some people maybe worry more than others, and I think most importantly about the techniques of how to cope with that. Follow on to this, we're going to be doing another podcast.
Yeah, and this is more to do with what we call hypothetical worry. So it's something that potentially could happen but isn't happening right now. And it's understanding the role that uncertainty plays in worry generally, but very specifically in hypothetical worry and how to cope with being uncertain.
That's great. Thank you so much, Peter. I think we've got a lot from today, and like I say, there's another podcast alongside this one as well, which you'll be able to find. Thank you, Peter.
Thank you.